Asylum for the Insane, A History of the Kalamazoo State Hospital, presented by Dr. William Decker, Distinguished Life Fellow of the American Psychiatric Association.
Hello, I'm Dr. Decker, a psychiatrist. I was employed by the Michigan Department of Mental Health and stationed at the Kalamazoo State Hospital. I was employed from 1953 until I retired in 1987. Joining me is Mrs. Carol Van Antwerp, a registered nurse, and she was employed at the hospital for several years in the children's service. During my tenure at the Kalamazoo State Hospital, I served in various capacities, first as a staff psychiatrist, and then as the director of clinical affairs and director of the children's services when that was established in 1961. Later, I became the assistant medical superintendent, and still later, I became the medical superintendent, serving the last 13 years in that position. I was the 10th and last medical superintendent at the hospital. The asylum, as it was known at the time of its origin, was the first asylum by the state of Michigan for the care and management of the insane, as the mentally ill were referred to in those days. With the recognition and awareness of the prominent role that the hospital played in the care and treatment of the mentally ill over the nearly 150 years of its existence, that the importance that it played in the history of the village of Kalamazoo and later the city of Kalamazoo, I was motivated to record that history in a book that I wrote and entitled Asylum for the Mentally Ill, A History of the Kalamazoo State Hospital. Now I'd like to share with you a slideshow presentation at the Van Dusen Room of the Kalamazoo Public Library. Following this presentation, there will be an opportunity for those in attendance to purchase a copy of the book and for me to sign up for them. Well, I guess we better get the show on the road. We've got a lot to accomplish tonight. First of all, I want to thank all of you for coming out on this very cool, drizzly, windy evening to join me in the introduction of my book, An Asylum for the Insane, A History of the Kalamazoo State Hospital. And I'm delighted to see so many of my friends and former and current employees of the hospital this evening. Now what I have planned for us is a slideshow that depicts some of the buildings and some of the events that occurred on the hospital grounds during the nearly 150 years of its existence. But before we start the show, I'd like to ask you to please be sure to sign the guest book. In addition, I prepared for you a list of some important and interesting vignettes, occurrences at the state hospital during those many years, and you're welcome to take those. I'm not sure that I thought that we're going to have a crowd this large this evening, so there may not be enough to go around, and if there isn't, please let us know and we'll see that you get a copy. In addition, you will also see on the table, and you're welcome to take one of my business cards that I had printed while I was the medical superintendent of the hospital. And you will also see a large brandy snifter that graced my desktop when I was a medical superintendent at the hospital. And you're welcome to take some of the Hershey out of there. I use that to diagnose visitors to my office. There was those that were very bold, and when they came in, they'd rush to the snifter and would help themselves to a large portion of the candy kisses. Then there were the shy and bashful who would wait until they were about to leave and then slowly creep up to the snifter, stick their hand in there and take 2 or 3. But it was always an interesting experience to watch the various personality types help themselves to what was in that snifter. In addition, let's see, we had something else there, Greta, for people besides the business cards and the Hershey Kisses and the vignettes. Pardon? And we tried to send postcards out to as many people as we possibly could, and certainly former employees of the hospital announcing this affair this evening. Unfortunately, we didn't have the addresses for everybody, so some of you may not have gotten them. And you're welcome to help yourself to a copy of those postcards. I want to thank my wife, Greta, and Sandy Leroy, our good friends. They were the ones that inspired the contents of that card and got it out notifying you of this event. If Steve, you lower the lights here, we'll get started with the slideshow. And the show is going to be relatively brief because we, as I said, our time is limited. We have to be out of the building by 9 o'clock. And I want to leave some time for you to ask some questions. Questions, in my experience, have always been much more fruitful and enjoyable than me getting up and doing a lot of talking. In addition, the books are here, and you can buy the book, and I'd be glad to autograph it for you this evening. I did want to point out also that we're fortunate to have with us my publisher and editor, Susan Bays. Susan, would you stand up a moment and look? Yeah. She needs a little therapy from me because we were uncertain as to whether that book would get here today. Last Friday, she made a trip from Traverse City, her workplace, to Grand Rapids, where the book was being printed, to assure that it would be here. She was assured when she saw that there were 4 cases of books available, and they did arrive here today at 2 o'clock. Okay, well, let's move on with the slideshow. The slide that you see projected there is an artist's conception of what the hospital would look like when it was completed in 1859, and that graces the cover of my book. The next slide that you see here is a picture of what was Bethlehem Hospital built in 1676 in London, England. Now, the name gradually became corrupted first to Bethlehem Hospital, so you'll see that in the book. It's not a misspelling. It actually was changed from Bethlehem to Bethlehem, and then later it was corrupted to Bedlam. And the name Bedlam came about because the patients in this hospital were so loud and so noisy that the visitors to the hospital and the residents in the area, local area, referred to it as Bedlam Hospital. Although this was called a hospital, in reality, the insane, and please excuse me when I use the language and the terminology that was in vogue at various times throughout the history of the care and management of the mentally ill. At that time, they were referred to as insane, as lunatics, and so on and so forth. And this was built for the care and management of the insane, but the insane fared really no better here at the so-called hospital than they had when they were contained in the places where they were formerly housed, such as poorhouses and the jails. King George III spent some time in this hospital receiving treatment for his periods of depression.